my name is Drusilla Perry. I'm 60 years old. I have been seeing Dr. Houston for around 2 years now. I was referred to him for my primary care physician because I had lower back pain. When I came to Dr. Houston, I felt like he had a lot of confidence in what he was doing, so that gave me a lot of confidence in him. My first visit with him, he did x-rays and an MRI, and he immediately knew what was wrong with me, and he knew how to fix it. He recommended that I have epidurals. When he first recommended that, I was really nervous, upset, afraid, because being 60 years old, I had heard a lot of people that had had trouble once they had had something like that done. But he reassured me that he used the best techniques, which he does. He has the best equipment that I have ever seen. He knows how to use it. When I went to get my first epidural, the girls at the Treasure Coast Surgery Center, they also helped assure me. I was so afraid that the shot was going to hurt. It did not hurt, and it also helped me a lot. Before I had the shot, it was very difficult for me to stand a long time or walk. If I walked, my example would be the mall. If I went to the mall with my daughter and walked around in the mall, I could not get back to my car. Once I had the epidural, then I was able to walk better and get around better, do more things in my life. I couldn't stand and cook. If I tried to stand up and cook a meal, by the time I had the meal cooked, I had to go to bed. With the epidural, I could stand and cook, do my regular housework. And again, I want to say that the epidural did not hurt when he gave me the shot. I was so afraid of that. Over the past couple of years, since I've been seeing Dr. Houston, I've had 4 epidurals, and he told me in the beginning that he could only give me 3 or 4 over a year's time. But the ones that he's given me have worked really well, and they have lasted. I can tell when they it's starting to stop helping me. And but I'm always one that kind of waits late before I come back. But then as soon as I come back, he schedules me and I have another epidural. Another good thing about Dr. Houston is anytime that I have needed to see him and I call, they work me in. They get me an appointment right away to get back in and see him, which I think is really good. Because if you're in pain, sometimes it's hard to wait 2 or 3 weeks to be able to see your doctor. But when I had the epidural, like I said, I was able to go out and do things. My quality of life improved. I told Dr. Houston that I'm 60 years old, but I don't feel like I'm 60 years old, and I don't want to be an invalid at 60. So that's how the epidurals have helped me.